Over the past few decades, Hong Kong's healthcare system has undergone remarkable development and has always been known for its medical excellence. However, extensive concerns have emerged regarding its effectiveness. Major criticisms highlight several key issues: a shortage of healthcare resources, especially with an aging population, a workforce shortage of professionals, and poor integration between public and private healthcare sectors. These limitations have led to numerous problems. For instance, a shortage of nurses tragically resulted in the death of an elderly patient. In this video, we focus on the demand for healthcare resources and their allocation across different regions of the city. Let's look at the total number of beds in public hospitals managed by the Hospital Authority, as well as those in private hospitals. The number of public hospital beds is significantly higher than that of private hospitals, reflecting the more important role public hospitals play in Hong Kong's healthcare system. Based on the location mapping of healthcare providers, we used to assume that New Territories residents may experience longer A&E waiting times due to fewer private and public hospitals. However, data shows that waiting times are indeed longest on Hong Kong Island, not in New Territories. We built a model to simulate the A&E waiting times using parameterized sigmoid and exponential functions to model how key factors such as hospital capacity, district population, travel time to the hospital, and household income level affect the waiting time. The percentage distribution is obtained from a simple regularization. The results align well with real-world data. So what is the reason for the longer waiting time in regions where hospitals are more concentrated? Let's consider the population composition and density of Hong Kong, and then rethink it in the context of the potential challenges. Here is a scatter plot of medical facilities in Hong Kong. Red points indicate private hospitals and clinics, while blue points represent public hospitals and clinics. Note how facilities are clustered in Hong Kong Island and Kowloon, while New Territories has a significant distance between facilities. We add in the population density of each region. The highest population density is concentrated in the Kowloon Peninsula and the southern part of Hong Kong Island, showing deep orange and deep red. The population density of most areas in the New Territories is low and is mainly shown in light blue and green. The distribution of hospitals in areas with high population density is more concentrated, and the dispersion of hospitals in areas with low population density seems to be very reasonable. However, we believe that densely populated areas may need more intensive medical services, such as emergency care and specialized care, while sparsely populated areas need more grassroots prevention and family doctor services. But resource allocation fails to distinguish effectively. Now let's consider the population across different regions, using a population pyramid that highlights the distribution in various areas. Overall, Hong Kong admits an aging population. Pyramids of different regions show that the New Territories has a large population base but is relatively young and may need more investment in basic healthcare resources. Hong Kong Island and Kowloon have a high aging population and need more specialist healthcare resources for the elderly. Demographic differences in Hong Kong mean that the type, structure, and focus of healthcare needs will vary from region to region. The allocation and service mode of medical resources also need to be adjusted and optimized accordingly to better meet the medical needs. Faced with the challenge of an aging population, Hong Kong's healthcare system is in urgent need of a profound adjustment. The medical service model should be redesigned and allocated effectively according to the needs of different age groups. Meanwhile, the government and societal sectors should raise public awareness of health management in specific age groups by collaborating to invest in preventive care and health education. Let us work together to build a healthier and more caring healthcare environment for every Hong Kong resident.